If you want to get pregnant but you're not ovulating or your periods have gone missing and your doctor can't find the reason why this is happening, you may have a condition called Functional Hypothalamic Amenorrhea, or FHA for short. That's just a fancy, long-winded medical term that means your brain has basically decided to switch off ovulation and put your reproductive system on pause, at least for now. But why would your brain do this, and what can you do to restore ovulation and restore your periods so that you can get pregnant as soon as possible? If this sounds like you and you'd like answers to these questions, then stay tuned. Juliette Millar. I'm a trained natural fertility specialist with over 25 years experience, and welcome to Focus on Fertility, the YouTube channel dedicated to supporting you on your fertility journey with science-based tips and information you can trust to help you get pregnant as soon as possible. In this video, I'm going to explain what FHA is, what causes it, what you can do to start ovulating again and get your periods back, and how long you can expect it to take. And as always, I'll link to any other videos or research I mention in the description below. So, FHA, what is it? FHA, or Functional Hypothalamic Amenorrhea, is not having a period for at least 3 consecutive months. So that is, you did have periods at one stage, you were menstruating, but now your periods have stopped, and you haven't had one for at least 3 months. FHA is sometimes also called hypo or just HA. The medical term for no periods is amenorrhea, and the medical term for no ovulation is anovulation. When you have FHA, you have both amenorrhea and anovulation, no periods and no ovulation, which might sound scary, but I want you to know up front, this does not mean there's something wrong with you. FHA is not a disease. In fact, if you do have FHA, your body is actually doing what it's designed to do, and that is to protect you. And I'll explain what I mean by that shortly. First, it's important to figure out if you actually have FHA. And to do this, it's crucial that you see your doctor. FHA is a diagnosis of exclusion, and that just means that all other possible causes of anovulation have been ruled out. Just because you're not ovulating and not having periods doesn't automatically mean you have FHA. There are lots of other reasons this might be happening. So it's really important that you see your doctor for a thorough assessment and some testing to figure out what's going on. One condition that's often confused with FHA is polycystic ovary syndrome, or PCOS for short. PCOS is the most common cause of absent or irregular periods by far. In fact, it's responsible for around 80% of all ovulation-related fertility problems. But it's possible to get a diagnosis of PCOS when, in reality, you actually have FHA. And that's because the symptoms can overlap, but the two conditions are very different and require very different treatments. And as well as PCOS, there are other causes of not ovulating, like thyroid conditions, high prolactin levels, primary ovarian insufficiency, breastfeeding and insulin resistance, just to name a few. So getting to the bottom of why you're not ovulating isn't always easy. And I often hear from women who, despite seeing their doctor, unfortunately still don't have an answer. So to help you figure out what's going on for you and to help you have a productive discussion with your doctor, I've created a comprehensive fertility guide called Ovulation Problems and How to Fix Them. It walks you through the most common causes of ovulation problems, including FHA, and for each one gives you some actionable steps you can take to kickstart ovulation again and get a healthy regular cycle back. Depending on the cause of your ovulation issue, you may need treatment by a doctor, but often you'll be able to fix the problem yourself, and I share how to do that in this guide. It's easy to read, easy to follow, and it's backed by the latest science. And I'll put a link to that guide in the description below. So, if you have FHA, what exactly is going on? Well, basically, your brain has made the executive decision to switch off ovulation, at least for the moment, and it stops talking to your ovaries. And I'll explain why your brain makes that decision and what you can do about it shortly. But first, so that you can really understand what's going on with FHA, let's think about what normally happens in a menstrual cycle very quickly. Just before your period starts, at the beginning of your menstrual cycle, the control center of your brain, the hypothalamus, sends out a hormone called gonadotropin-releasing hormone, or GnRH for short. And it sends it out in spurts or pulses. Those pulses of GnRH talk to the pituitary gland, which is also in your brain, and tell the pituitary gland to send out two more hormones, FSH and LH. And those two hormones are also sent out in pulses. That FSH and LH then travels through your bloodstream and down to your ovaries. The job of FSH and LH is to communicate with your ovaries and get them to grow and release an egg. In turn, through this process of growing an egg and then releasing it at ovulation, two more hormones are released from the ovaries, estrogen and progesterone. Estrogen is the dominant hormone before ovulation, and progesterone is the dominant hormone after ovulation. And those hormones communicate back to your brain to let you know what's going on in your ovaries. If you don't get pregnant, at the end of your cycle, the levels of estrogen and progesterone drop off, you get your period, and the whole cycle begins again. Now, if you have FHA, none of this happens. Your brain doesn't communicate with your ovaries, and your ovaries don't communicate with your brain. Your hypothalamus has effectively shut up shop. But there's nothing actually wrong with your hypothalamus. It's not damaged in any way. It's just not sending out the signals. So if you get your hormones checked, if you have a blood test, what you'll typically see is low or low normal LH, normal FSH, a low LH-FSH ratio, low estrogen and low progesterone. And that's one of the ways your doctor can tell the difference between FHA and polycystic ovary syndrome, by looking at your LH and FSH levels. If you have PCOS, LH is typically high compared to FSH. But if you have FHA, LH is typically low compared to FSH. And sorry, that's a lot of acronyms. As well as these low hormone levels, you might also experience symptoms due to low estrogen, similar to those we expect at menopause, like night sweats, brain fog, difficulty focusing, feeling sluggish and lacking motivation, and genitourinary symptoms like vaginal dryness or discomfort and urgency to pee more often. And again, those symptoms are due to low estrogen. So why does your brain stop communicating with your ovaries? Why does it make that executive decision to stop sending out those hormone signals and switch off ovulation? Well, basically, your brain has decided that now is not a good time to have a baby. It's detected some form of stress or malnourishment and decided that it's not a safe time for you to be pregnant. So it's actually protecting your health and well-being. Being pregnant and feeding a baby takes a lot of energy, a lot of extra calories. So by shutting down reproduction, your hypothalamus allows you to conserve that energy and prioritize it for functions it considers more important, like breathing and pumping blood, that allow you to survive. And biologically, this makes sense. If there was a threat to your survival, like a famine or a war going on, and you didn't have enough calories on board to support a pregnancy, you and your baby could be at risk. So your brain is doing what it's designed to do. It's just trying to protect you. So what causes your brain to think that now is not a good time to get pregnant? FHA is usually the result of three things: not eating enough, over-exercising, and or too much stress. And it's not just psychological stress that we usually think about, but anything your body perceives as stress. So things like fast or sudden weight loss, having a long-term illness or undergoing an operation, or even traveling to different time zones can have an impact. Very often it's caused by a combination of these factors, and some people are more susceptible because of their genetics. Now, this next point is really important. The most common cause of FHA is something called low energy availability. We need to have a certain amount of energy on board for healthy ovulation and regular menstrual cycles. And of course, we get that energy from the food we eat. If you're not getting enough calories from food to cover the energy demands of your day-to-day activities and your exercise, your body enters an energy deficit, or a state called low energy availability, or LEA. Low energy availability is more likely if you do a lot of exercise. For example, if you're a long distance runner or an athlete or a dancer, or you do lots of high intensity gym workouts. And it's important to know that you can have low energy availability even if you're a normal weight. The exercise itself isn't so much the problem. It's when you don't eat enough calories to compensate, and it causes you to enter that low energy state. Now, you might remember earlier I said that FSH and LH are sent out from your pituitary gland in pulses. Well, the interesting thing is that when you're in a state of low energy availability, those LH pulses become less frequent. That means your ovaries don't get the signal they need often enough. And since LH helps your egg mature and be released, this reduction in LH signaling can stop you from ovulating normally and lead to irregular or missing periods. We know from the research that the more energy availability drops, the less frequent the LH pulses and the higher the risk of ovulation problems. In fact, one study found that a decrease of just 1 unit in energy availability was associated with a 9% increase in the likelihood of experiencing a menstrual disturbance. But there doesn't seem to be an exact threshold. The amount of energy deficit that triggers periods to stop will vary from person to person. So if you have FHA, if you've lost your periods, what can you do to restart that communication between your brain and your ovaries and switch ovulation back on? The goal is to convince your hypothalamus that all is well and it's okay to start having periods again. So the fix is going to depend on the underlying cause of your FHA. If you think you have an energy deficit, as we just talked about, then one of the first steps is to correct that deficit. So that means either eating more, exercising less, or both. But that's not all. Think about what else is going on in your life that your brain might perceive as stress. Have you crossed time zones recently, or is international travel part of your job? Are you in an unhappy relationship? Do you have stress because of family issues? Are you studying and experiencing stress with your course or exams? Do you have a long-term illness you've been dealing with, or past trauma? Some of us can experience these things and our cycles just carry on like clockwork. But for others, our bodies are more sensitive and it doesn't take much to throw things out of balance. As I said before, FHA is often a combination of factors or stresses, so it's important to consider all the factors that might be contributing. That way you can work to treat them all to allow yourself a full and fast recovery. And in the fertility guide I mentioned earlier, I walk you through these various possible causes of FHA to help you figure out which ones might apply to you. So don't forget to check that out at the link below if you're interested. And I've also made a follow-on video to this one with 3 tips on how to correct that state of low energy availability that I talked about earlier, which is probably the most common cause of FHA. So check out that video next, which again I'll link to in the description below. Okay, once you've addressed the likely causes of your FHA, how long can you expect it to take to get your period back? Well, it depends on the person, but studies suggest that if you reverse that state of low energy availability and reduce your stress levels, you can expect to get your periods back and start ovulating again within 3 to 12 months, often within just 6 months, but it can take longer. How long it takes for you will depend on a number of factors. But most importantly, it's going to depend on how quickly you make the necessary lifestyle changes, how well or consistently you stick to those changes, and how long you stick with them, how patient you're prepared to be. So again, in general, I'm talking about making sure you're eating enough, modifying your exercise levels, and managing your stress. But what if these changes don't work? What if you need to get pregnant as soon as possible due to your age or other factors, and you just haven't got time to wait? Well, the good news is that certain fertility medications and treatments like IVF can help. They won't cure your FHA like lifestyle interventions can, but they can help you get pregnant. And a reproductive endocrinologist or a fertility clinic doctor is the best person to discuss this with. Well, that's almost it for today, but before I sign off, it's important to mention that FHA is more than just missing periods. If it remains untreated, it also carries some serious long-term health consequences, particularly for bone and heart health, and that's due to those low hormone levels. So I encourage you to talk to your doctor about getting some form of hormone replacement if you haven't already been offered this, to see if it's appropriate for you. It's usually given as an estrogen patch, an oral progesterone or progestin, and it should also help with those low estrogen symptoms that I mentioned earlier. Okay, well that's it for today's video. If you found it useful, please give it a big thumbs up, give it a like, and let me know in the comments what you found most helpful. And of course, if you'd like to see more videos like this one, make sure to subscribe. I'd really appreciate it. Bye for now.